Good afternoon, esteemed professor and guest. My name is Mary Luanga, and I will be your moderator for today. And today's presentation is on harnessing the power of radioactivity for better health. Now, under normal circumstances, when many people hear radioactivity, they think, oh, there's danger or risk. However, in medicine, it is carefully controlled and has become an essential tool for diagnosing and treating diseases. Okay, so important strict safety measures have been put in place to ensure that it is carried out safely. And as you listen, I invite you to consider how something that is often perceived as harmful can actually be useful and for good. I introduce my first speaker, and that is Simon.
Good afternoon, everyone. My name is Chris, and I'm studying Premedical Science at the Premedical University. The title of presentation is titled Harnessing the Power of Radioactive for Better Health. The title of our presentation is Harnessing the Power of Radioactivity for Better Health. What is nuclear medicine? Nuclear medicine is an advanced imaging tool that focuses not only how the body looks, but well as how it functions. It combines medical imaging and radioactive science to help detect disease early. It's used to diagnose and treat conditions like cancer, heart disease, and organ disorders. It uses small radioactive substances known as radiopharmaceuticals, which are used to diagnose and treat by showing how organs and tissue functions. So unlike the traditional X-rays and CT scans, which only shows the structure, it shows information at molecular level for early and precise diagnosis. How it works. Administration. The radiopharmaceutical is given to the body via oral injection or inhalation. So in this process, the tracer is put in the body and it moves to the targeted body organ needed for treatment. Distribution. The tracer moves through the body and is absorbed by specific organs or body tissues. The pattern which is formed by the tracer helps doctors to understand how organs activities work and how they're functioning. We go to the other part, which is detection. Special cameras such as PET scanners are used to detect the radiation of the tracer once it is already in the body. So these scanners capture signals from inside the body, allowing precise measurements of the organ activities. Image creations. Computers generate detailed images that show normal and abnormal physiological processes within the time. Combined imaging, after everything has been done, and combined imaging technique like CT, PET scanners, and anatomy for better analysis. So this provides a complete picture of everything once that's all been combined together, helping in accurate diagnosis and treatment planning of everything. So from now on, I would like to invite my next colleague to take through the other part of the presentation.
Good afternoon, everyone. My name is Nene Puri. I'll be covering the various types of nuclear medicine procedures that play a crucial role in diagnosing and treating diseases. These types of nuclear medicine procedures can be divided into diagnostic procedures, therapeutic procedures, and hybrid imaging procedures. I'm now going to explain on these nuclear medicine procedures in detail. I'll first start with the diagnostic procedures. So diagnostic procedures, these use radioactive tracers to image and assess organ function. The primary purpose of these diagnostic procedures in nuclear medicine is to detect disease by evaluating organ function and metabolism, rather than just the structural detail. By administering radiopharmaceuticals that accumulate in specific cells, physicians can visualize how organs are working in real time. This allows for early detection of abnormalities before they become visible on conventional imaging. Examples of scans used in diagnostic procedures include PET scans. So PET stands for positron emission tomography. A PET scan uses radioactive glucose known as fluid deoxyglucose to image metabolic activity in cells. It's widely used in oncology to identify cancer spread, in cardiology to assess myocardial viability, and in neurology to study brain activity in conditions like Alzheimer's disease. Another type of scan used in diagnostic procedure is a PET scan. So PET stands for single photon emission computed tomography. So this uses radioactive tracers to image functional activity in organs. It's commonly used for cardiac perfusion studies, bone scan to detect metastasis, and it's commonly used for thyroid imaging to evaluate nodules and function. I'm now going to explain on the therapeutic procedure. So therapeutic procedures, these use radioactive agents to treat diseases like cancer by targeting specific cells. This focuses on treating diseases using targeted radiation delivered by radiopharmaceuticals. The tracers are designed to accumulate in diseased cells where they emit radiation that destroys abnormal cells while sparing most healthy cells. This makes nuclear medicine, for now, a cornerstone for precision therapy. Examples of therapeutic procedures include radioiodine therapy. So this uses radioactive iodine, which is iodine-131, to treat hypothyroidism and thyroid cancer by selectively destroying abnormal thyroid cells. And then another example is the radionuclide therapy, which uses lutetium-177 and yttrium-90. So these new agents of radiopharmaceutical therapy are used in neuroendocrine tumors and liver metastases, delivering radiation directly to cancer cells. Bone pen palliation is another example of therapeutic procedure in nuclear medicine. So we use strontium-87 and samarium-153 these are the radioactive agents that provide relief for patients with painful bone metastases. My other point is hybrid imaging procedures. So hybrid imaging procedures combines nuclear medicine. Hybrid imaging procedures. This is a combination of nuclear medicine's functional insights with an anatomical precision of conventional imaging, such as CT or MRI. This integration enhances diagnostic accuracy by showing both where a lesson is located and how it behaves metabolically. Examples of these hybrid imaging procedures, which can be used in nuclear medicine, is a combination of PET and CT scan, SPECT and CT, and PET and MRI. So PET and CT scans This is a combination of facts, metabolic information with CT's anatomical detail. It is the most common hybrid modality used extensively in cancer staging, monitoring therapy response, and detecting recurrence. SPECT and CT scans. So this is a combination of SPECT functional information with CT's anatomical detail. So this improves visualization of bone lesions, cardiac perfusion defects, and thyroid abnormalities. We also have the SPECT and MRI. So this uses imaging modality or by combining metabolic and soft tissue imaging. A new technology that measures useful in brain and pelvic cells. So in summary, diagnostic procedures provide functional imaging for early disease detection. Therapeutic procedures deliver targeted radiation for precision treatment, and hybrid imaging measures function and anatomy, offering the most comprehensive view of disease. I would like to hand over to my next colleague.
Good afternoon, ladies and gentlemen. All protocol already been observed. My name is Laxwell Rukwesa, and I'll be taking us through how does nuclear medicine compare with other conventional modern medical modalities such as X-ray, CT scans, and MRI. Well, someone may ask, why compare imaging modalities? Well, different imaging techniques reveal different aspects of the body. Some show structures, others show function. Comparing them will help us see where nuclear medicine fits best within the medical fraternity. The basic principle of how it works compared with CT scan and MRI. Well, first, make us understand it easily, we must know that radioactive substances are either ingested or swallowed. On the other end, X-ray and CT scans, they use external ionizing radiation that passes through the body to create detailed images of internal structures and anatomy. MRI, on the other hand, it uses strong magnetic fields and radio waves, not radiation, to produce detailed soft tissue images. Number two, we'll look at the types of information each provides. Nuclear medicine shows functional or physiological processes, such as metabolism and organ performances. X-ray and CT scan, on the other hand, it shows details like bones, tumors, and bleeding. While MRI also shows structural but an excellent soft tissue contrast. You see us putting X-ray CT scan in the same place. Well, maybe I can give a brief explanation of the background. X-ray uses high energy waves, X-ray waves that are beamed through the body. And as they beam through the body, when the soft tissue, they pass through the soft tissue, showing a halo image, the part where there's soft tissue. And bones have got calcium, which absorb a lot more of the energy. And on the image, they will show a bit whiter. So you think of CT scan as like X-rays that is put together to form a 3D image, and X-ray being a 2D dimension of an image. So you see me put X-ray and CT scan together. And MRI uses magnetic waves with radiation, which I'll talk about soon. But just a big background so that you understand nicely as I compare them. So thirdly, we talk about the image qualities and characteristics. Nuclear medicine, it has low spatial resolution, but provides molecular and metabolic data. As my friend alluded earlier, we can see in the slide the detailed picture and colors. You can see movements, how the organism, how the organ is functioning in real time. You can see a heart beating, you can see movements going on in the brain. CT and X-ray shows high resolution and rapid imaging. And on the other hand, MRI shows very high soft tissue contrast, but it is slower and costly, which we look at again soon. Radiation exposure is another difference we can look at. Nuclear medicine and CT both use ionizing radiation within safe clinical limits. MRI, on the other hand, there's no ionizing radiation and it is safer for repeated use. And lastly, we look at the typical uses. Nuclear medicine is mainly used for cancer detection, heart and kidney function, thyroid scans and bone scans, X-ray and CT, mainly used for trauma, fractures, checking of chest infections, and checking of internal bleeding. MRI is mainly used for brain, spinal cord, and soft tissue evaluations. A quick table to help us look at what I've spoken about. There's radiation types, internal tracers versus external tracers. One ingests or is injected radioactive tracers into the body that will accumulate on certain organs so that we can see the function in real time. X-rays beamed externally and certain parts of the body reacts different with radioactive the radioactive energy that is beamed through the body. MRI doesn't use radiation. Nuclear medicine focus on function, X-ray on structure, MRI on structure as well. Image resolution low on nuclear medicine, higher on X-ray and CT, and very high in MRI. We get clear tissue structure. Safety, moderate radiation is seen on nuclear and X-ray within safe clinical limits, and higher on radiation because there's no radiation involved. Speed, nuclear and medicine is moderate. X-ray and CT are faster. That's why usually they are most used in quick decision making. And MRI is slower. On cost, you see nuclear medicine is moderate to high, X-ray moderate to high, and MRI is a bit higher on cost. A key takeaway, while X-ray, CT scans, and MRI show what the body looks like, nuclear medicine is advanced medicine to be able to see how the body works in real time. And that's why it's often used alongside these other medical modalities to make a complete diagnosis. Thank you.
Good afternoon, everyone. The video on has already been discussed. I'll focus on the common applications and benefits of nuclear medicine. So, where exactly nuclear medicine is in practice? First, in heart conditions, nuclear medicine is used to assess blood flow to the heart muscle and detect areas of reduced effusion or damage, especially after a heart attack. It is also used in cancer management to detect tumors and monitor their progression and evaluate how well patients respond to treatment. In addition, it is used to diagnose and monitor brain disorders such as Alzheimer's, epilepsy, or strokes by showing how the brain is functioning. And finally, it is also used to evaluate how the thyroid is functioning and detect any abnormalities. Now, what makes nuclear medicine particularly powerful is that it doesn't just show how the organs are, but also how they function. In other words, it can detect a disease at the functional level, often before the physical structure change even occur. Because of this, nuclear medicine has several important benefits. First, it allows for early detection of the disease, sometimes even before symptoms or structural changes can occur or appear. This helps or improve treatment planning. It also provides accurate and reliable diagnostic results, which improves or which makes diagnosis, which makes or help in correcting diagnosis. In addition, it's the procedures of nuclear medicine are generally safe and painless. And most importantly, it helps doctors to choose the most appropriate treatment method and monitor patient progress. Overall, nuclear medicine not only shows how the organs work, but more importantly, it shows how they function. This makes it a valuable tool in improving diagnosis and guiding treatment and enhancing patient health care. Thank you. I'll now hand over to Luis.
Good afternoon, everyone. My name is Hatra Devi, and I will be presenting on the potential risks and side effects of nuclear medicine. Despite nuclear medicine being the most advanced medical procedures to diagnose, it also comes with important procedures and considerations which we must all understand as patients and healthcare. I'll first start with the potential risks. The first one, which is radiation exposure. As patients undergo nuclear medicine procedures, they are exposed to high levels of ionization radiations. Despite healthcare workers taking precaution with the doses, repeated use of this exposure can have a high risk of cancer of the environment. The second one, which is allergic reactions. Some patients may experience allergic reactions to the radioactive materials, though these things are mostly rare. These allergic reactions may include rash or itchiness or swellingness on the site where the radiation materials were injected. The third one is effects on pregnancy and breastfeeding mothers. As the radiation materials can have effects on developing fetuses and also can be passed through breast milk through when the baby is sucking through the mother who is going through such procedures. Due to these facts, radiation procedures is highly avoided to breastfeeding mothers and pregnant women. I also would like to add on potential risks, which is not a part of my points, which are nephrotoxicity. This nephrotoxicity is the damage of the kidneys. In reference to nuclear medicine, nephrotoxicity is when nuclear medicine materials are too much for the kidney to handle and hence destroys the kidney. This mostly comes about when patients are very dehydrated during the processes or when the doctors haven't yet taken organ tests to treat or to see if the kidneys or any other organs can handle these radiation exposures. I'll now go to the side effects. Side effects, despite them not being very common, but they are very visible in some patients. Some side effects, which are mild side effects, which is nausea, headaches, dizziness, or flashing awakes, can be seen or can be taken quite risky by some patients, and these mild effects rarely can be handled by medical frontiers who are ready to take courses and to take care of such issues. The next part is injection site reactions. Some patients can react to some medicine or some materials which have been injected, which can cause swelling, redness, or itching on the site where the materials have been injected. And the last, but not the least, is the temporary change in organ functions. Some tests can cause some changes in some organ functions in a human body. Despite this, it can be a very short-lived process and it cannot be very permanent. I would like to now hand over to the last colleague to summarize.
Welcome to my students, guests, and meetings. I am taking you through on the imaging trends and technology, or rather the future of nuclear medicine. The future of nuclear medicine is focused on making diagnosis and treatment more precise and more effective, as well as being personalized. One major development is therapeutics, which is just a combination of diagnosis and treatment using the same radioactive substances. To be precise, this allows doctors to detect and treat diseases like cancer more accurately. Another important advancement is the use of artificial intelligence. With this introduction, AI can analyze medical images faster and more accurately, helping doctors detect diseases earlier and reduce human error. In addition, new radio tracers are being developed to identify diseases at a very early stage, sometimes even before symptoms appear. Future applications in medicine. There are also improvements in cancer treatments, such as the use of alpha-emitting radionuclides, which can destroy cancer cells while using minimal damage to healthy tissues. Another point, imaging technology is also improving with more advanced scanners, providing clearer and faster results. Furthermore, efforts have been made to reduce costs and to make nuclear medicine more accessible in hospitals worldwide. In conclusion, nuclear medicine is a powerful tool that focuses on how the body functions rather than just its structure. It plays an important role in diagnosing and treating diseases such as cancer, heart conditions, and brain disorders. With advancements like artificial intelligence, therapeutics, and improved imaging technologies, the future of nuclear medicine is very promising. It will lead to earlier diagnosis, more personalized treatment, and better patient outcomes. Despite some challenges, nuclear medicine will continue to play a vital role in improving healthcare and saving lives. Thank you.
Thank you to our presenters for presenting. I would like to invite any questions or comments from our esteemed professors and guests.
I think try to check the audience if the people who are participating online. Madam Shinondo, she's still not connected.
She's there, but I don't think she's able to talk where she is.
So are the participants there?
Yes, they are.
Then if the moderator asks the participant first, briefly to ask a question first before you come to us.
Okay.
You can even do a roll call, people who have participated.
Who are online?
Yes.
Is there anyone online who has a question, comment? I believe you can either unmute your mic or you can type the question in the comments. It will be able to be seen. It appears there is no question.
Nobody. Okay, let me start by thanking you, the moderator, and the presenter. You're very good, very. Being first year and the pre-med, you are speaking with confidence, and the topic you seem to have understood it. Nuclear medicine, how important it is. I wanted you to, the way you have mentioned the thing, the body creation was in 7 systems, okay? You have referred to central nervous system, cardiovascular system, respiratory system, gastrointestinal tract, genitourinary system. We talked about the kidneys and the complications that may occur. Genitourinary system and endocrine system. I saw you mentioning thyroid. Then musculoskeletal. So you see that nuclear medicine has found use in all these. You understand it? Very UTH bought the nuclear medicine gamma camera in the 90s. In the 90s was popularized. In fact, towards the end of 80s, Professor Annie Bailey was the head of surgery then. She was very happy to talk about nuclear medicine. It was one of the first equipment before CT scan. Yeah, nuclear medicine there. And in fact, the 1997, I'm mentioning one special situation we had. 1997, January, there were twin babies who were born. Diagnosed in the Matero, patient referred to UTH, and ultrasound showed that they were connected. And the operation was done. They had one head facing opposite side, the face is the opposite side, the body opposite side. It was a very big challenge. The question was, how are they connected inside this single scar? Single scar with the two brains in it, how are they connected? With the brain tissue? We needed nuclear medicine. And that was the only equipment we had which could give us a rough idea. Are these children connected? And they did nuclear medicine. It showed venous drainage. 50% of blood of one twin is going to the twin brother. The other brother was receiving again another 50%, you know. So we used it to check. Do they have independent liver, independent kidney? We were using nuclear. So I'm saying UTH, at least we had a rough idea. But we needed angiography because it showed that the venous drainage was being shared 50-50. I'm just giving an example of how useful this nuclear medicine we are talking about, the gamma camera, which we had in UTH. But angiography we had, but perfect angiography, MRI we didn't have. So we had to go to South Africa. And South Africa demonstrated now there's the MRI. There's a direct angiography. These are specialized equipment. And it confirmed what gamma camera had shown. It was confirmation. and to decide how we can disconnect these children. There's no way they can grow up if one wants to carry on top of the other one and they are facing opposite direction, so it's just difficult to manage. This is an operation which I personally took part in. And it took us 30 hours to separate. It is a special, and the good thing is that God wanted them to live. Because the literature showed that majority of them, they die during the operation, both of them. Or one of them died, the other one lived, or they are they are disconnected, but they are all vegetative state. But in the case of Zambian twin, they both survive and they are well. They are in Chirengesa. There's Luke and Joseph. They are big boys now. From 1997, how many years are they now? 3 plus 26. 29 years old. And it's a miracle. Ben Carson, you read his Ben Carson. He was our chief sergeant. And from Zambia, it was me. And the 2 South Africans, one from Johannesburg, the other one from Pretoria, a team of 4. But of course, even their necessities, it was so special. We have to make teams. Team 1, team 2. When we separate them, this team takes charge, this team takes charge. So I'm trying to tell you that what you are presenting today is very important. You get challenging things during your practice, but always respect teamwork. The nurses were in 2 groups, anesthetists 2 groups, and the surgeons were followers. So when we separate, 2 go this one, 2 goes this one. We use it. But also thyroid. If you want to see thyroid properly, the functional part, is there a node? Is it an active nodule increasing thyroxine, T3, T4? Which lobe is it? This gamma camera can show you the thyroid. That's endocrine thing, cardiovascular thing. The brain tumors, vascularization of a tumor may be different. And you can use this gamma camera. The lung, bronchogenic carcinoma, the lung cancer. If you want to know the functional aspect of that, how vascular is it, so that you prepare yourself how many units of blood. For example, those twins, they were babies born in 4.9 kg combined weight. But at 11 months, they were about 5, 6 kg. Yeah? You know how much blood we prepared in theater? 86 units. South Africa. You can imagine fear of bleeding. But in the preparation, but the operation was so meticulous. I think if we did transfuse, it may just have been 1 week out of 86. But I'm trying to tell you, this is a delicate situation. You need to know vascularity, how much blood supply is there, and where you're going to cut, what is the expected hemorrhage. The strokes, you mentioned about strokes. There are 2 types of thromboembolic, which means blood clot has formed somewhere and it has moved to block, and you call the stroke. Or hypertension, the blood vessel has burst. There's the hemorrhagic artery of Charcot as a branch of middle cerebral attack. You read about it as you grow. You read in anatomy, you understand? So you are studying very well. I'm very impressed. You are applying physics to this situation. You have built on it. Don't lose these notes. To be referring to them as you grow in your training. Musculoskeletal deepening is very, very much needed. You know, you've talked about metastasis to the bones. At your talk, you are letting them go. Metastasis to the bone. Where has the tumor gone in the bone? The rib, the spine, the long bone. You can detect using, okay? Because where it goes, especially if it's vascular, it will show at the hot point. Gamma camera will even pick and show you that the concentration is here. So you can interpret. You are very good. The moderator, don't stop. It's your presentation. Prepare them for more presentation. But we want to see physics, chemistry, biology, and mathematics. You should be preparing. Monday is your day. Share Monday. We have said 12:30 to 13:30. Prof, over to you. I've got a visitor, so 100. Congratulations. Thank you very much.
Thank you very much, Prof. Thank you very much and good afternoon. I hope you know my name. You are afraid of me. I'm Professor Mlenga. I'm the Deputy Vice Chancellor for Research and Innovation for the University. I'm a medical doctor background, and I'm also a medical research. Right. From what you're saying, also done medical research. But has made a lot of changes to the way we treat patients in Zambia. But I just want to begin, first of all, by congratulating you for putting up such a good presentation. I know that for you to produce something like this, you must have done a lot of work in the background, a lot of reading. Keep that knowledge. You will need it. Some of you may even think of specializing in some of those areas. There are so many uses of the diagnostics that you talked about. Medical practice. At some stage, you're not even using in research because there are measurable things out there. Like what Prof. Lambert has said, oh, we use to have this camera. I think take another step if you haven't done so. To go to the hospital and see these things in real time. Then your image will be complete. You see what I mean? In some places, oh, that thing is just found that side, but you haven't seen it just in the box. Time has come for you. I think the moderator Dallas can arrange a trip. Either UTH, Rena Soko, Levy. You basically, you physically see these things. And if anything, they can even demonstrate to you some of these things in use. You see? And then that creates a complete picture of what you're talking about. And that's where you live. So I love that the moderator at some point, right now, later on, we complete that picture and see what's happening. Because we have radiology in the university up to consultants level. So you see that we're well equipped actually to even show you some of these pieces of picture you clearly and very nice to summarize. Very clear presentation. I don't think maybe that's why we're not having many questions out there. There are so many things that where nuclear medicine is also used. Like we are saying things to do with research, but even nutrition. You know, protecting nutrients within the body, especially micronutrients like vitamins and things like that. They also used. They are even used in other diagnostics. Bacteria. You use in parasitic. You project those nuclear materials in the diagnose other organisms that are within the human body. So you can even extend your searches into indirect ways of diagnosing problems in the human being. Because this time we've been talking about direct only, but you can have pathogens that you can take using so the area is very big, but we don't want to exhaust you that you go deep into it. This is a very good demonstration of the application of physics in medicine, and you've done a very, very good job. I just want to add Professor Lambert's comments that you've done very, very well. The presentation is very confident. That's what we like. When you go up there, remember when you need to doctor, through your life, it's about presentation. Much of it is about expressing your knowledge by talking. Because this let me write in the small piece of paper. No, it's like that. You be at the bedside talking real things. So see them, touch them, see them in action, then you won't really forget. Once you read, you're just confirming what you're reading or adding on what you're reading. I think for the group moderator, thank you very much for the wonderful presentation. If we don't have, the presenters can still give us some more information on anything we need to emphasize or clarify, or praise yourself.
Yes. Any closing remarks, presenters? Anybody wants to?
Good afternoon once again. And this was a very, very tiresome journey in my life. It might be a very short presentation. Like the professor said, there's a lot of this. I would like to give thanks to the professors and the deans present and not present. I would like to give thanks to the IT and the moderator who are present. And I would also like to give thanks and encourage my colleagues to do better and to participate more in such presentations. As we close, it's just the fun thing about it. Thank you.
There is a question. Hello, do you have to be a doctor to study radiology?
Apparently, yes. You've got to be in the field of mind. People want to do radiology legally are doctors. Because you have to have a comprehensive understanding of the functioning of the body, its physical structures, its normal state, and then the abnormal state, for you to understand the comprehensive picture of it. Otherwise, it will be very fragmented. Fortunately, unfortunately, the people who do radiology are really connected.
All right. Thank you for that response, Professor. Thank you to everyone who was present for this presentation. Thank you, esteemed professors and guests, for your attention and your time. We are now concluding, or have concluded. This is the end of the presentation.
Thank you very much. Go well and stay home.